Okay, we're going to go over another case of acute uncomplicated appendicitis. Again, we have our axial images here, we have our coronal there. This is a CT with contrast. As we scroll down, we're going to look for that terminal ileum. For this case, it's a little bit tricky because there's so much bowel, small bowel, that kind of comes here right near the colon and the cecum. But if we actually follow this loop of bowel, this one right here, and we follow it to the cecum, we see that it actually plugs in here and that there's actually a fatty valve right there. So, and this slice here, I think, is the most helpful. Right here, it's kind of plugging in. And if we do a little bit of co-localization, right there, we can see the ileocecal valve right there. So that bowel is kind of like in plane, coming here, and plugs right into the cecum there. And then we have our ileocecal valve. So it's a tough one because it's so busy right there. But this is our terminal ileum. So now we have to look for the appendix. Somewhere around here, around the cecum, is going to be the appendix. And when we start scrolling down, we see a pretty good candidate over here coming out laterally. And if we follow that tubular structure right here, looks like it's blind ending, and we can co-localize there as well too. And this looks like a pretty good look for the appendix. And if we want to confirm that it's indeed coming off the cecum, right here I think is a really good look for it. Right where we had suspected before on the coronal, it really shows us it's retroflexed, going back behind the colon, but that is our appendix right there. So we can see it diving deep near the psoas. Now there's all this periappendiceal inflammation, all that fat stranding that we see. And we can confirm that it's blind ending. It ends somewhere around there, touching a different part of the colon, but not coming off there, but that's where the tip is. So right here, so it's blind ending. So that looks like a good look for the appendix. And then it does look, we can measure it, but it does look inflamed. And it does look like it's probably above 6 millimeters. So we'll put a measurement on it. It's about 1.2, give or take. So it's dilated, inflamed. It looks hyperemic. Good look for appendicitis, which this was, and it was confirmed on pathology and in the OR. And of course, just like everything else, we can quickly put on our lung window, look for any evidence of free air, which we actually don't see, and go back. Look for any evidence of free fluid, no focal fluid collection, nothing like that. Maybe a little bit of reactive fluid here near the pericolic gutter, but otherwise it looks like an acute, uncomplicated appendicitis.